Think of One Health hacks as small, practical actions recommended by different kinds of doctors that protect human health by also caring for animals, ecosystems, and the social environments that connect them. It's a simple phrase with a broad reach. A hack is an efficient, evidence-informed tip. One Health is the idea that human, animal, and environmental health are inseparable. Put together, One Health hacks are concise, doable behaviors or practices from a pediatrician, a veterinarian, an infectious disease specialist, a psychiatrist, an environmental health officer that reduce risk, improve well-being, and respect the larger systems that shape health. Why does this matter? Because medical problems rarely sit inside specialty silos. A dermatologist's advice about preventing tick bites can stop Lyme disease in a child. A dentist's counsel about oral hygiene can reduce respiratory infections in an elderly care home. A surgeon's attention to antibiotic stewardship lowers selection pressure that breeds resistant bacteria in both people and livestock. Each specialty brings a particular vantage point and a set of actionable tips that, when shared across professions and with the public, multiply their benefit. One Health hacks make those cross-cutting connections tangible and usable. For example, a primary care physician might offer a simple vaccination schedule and travel hygiene checklist that reduces zoonotic exposure during international trips. A veterinarian could teach proper animal handling and waste disposal practices that cut pathogen transmission at the human-animal interface. An infectious disease doctor will emphasize hand hygiene protocols and environmental cleaning that prevent hospital-acquired infections and curb community spread. These are specific, replicable practices that work because they acknowledge ecosystems and animal reservoirs as part of human disease pathways. Experts often stress that small changes have outsized effects. Public health authorities and clinicians increasingly support integrating animal and environmental perspectives into routine care. A view echoed by conservationists who see human behavior as pivotal to protecting biodiversity, and by epidemiologists tracking spillover events. Some critics caution that bundling advice across sectors can overwhelm clinicians already pressed for time, or that simple hacks may be misapplied without context. Those are valid challenges. The response is to prioritize high-impact, low-burden interventions, and to pair hacks with clear criteria about when to escalate care or consult specialists. Connecting this introduction to the rest of the series, each upcoming segment will present a specialty-specific One Health hack, explain the evidence, show how it prevents harm across species and settings, and suggest practical steps for clinicians and the public to adopt. Think of primary care as the home base of health, where prevention and everyday choices matter most. A primary care perspective focuses on small, sustainable habits patients can use every day to prevent illness, manage chronic conditions, and boost overall well-being. These are practical, low-cost, evidence-based actions that make a big difference over time. Start with sleep hygiene. Consistent sleep timing, going to bed and waking within the same 60 minutes each day, regulates circadian rhythm, improves mood, strengthens immunity, and lowers risk of metabolic disease. 2 easy steps. Pick a realistic bedtime and dim screens 30 to 60 minutes before. Patients with work or family demands can use a wind-down ritual, reading, light stretching, or a cup of non-caffeinated herbal tea to signal the body it's time to rest. Second, emphasize 1 more minute of movement. For sedentary adults, the hack is to add a single standing or walking minute each hour. It improves circulation, reduces back pain, and lowers cardiometabolic risk. Practical applications include standing during phone calls, parking farther from the store, or pacing while brushing teeth. For those with mobility limits, chair-based leg lifts or seated marches work just as well. Third, make hydration visible. A reusable water bottle with time-marked targets or a phone reminder prompts regular drinking, which supports kidney health, cognitive function, and energy. Encourage swapping one sugary drink per day for water. This small change reduces calorie intake and helps manage blood glucose. Fourth, introduce the 2-item approach to medications and screenings. Each visit, identify the 2 most important prevention tasks, like getting the flu shot and checking blood pressure at home. This simplifies decision-making and increases adherence. Examples include setting a monthly alarm to check blood pressure with an at-home cuff, or scheduling cancer screening during a routine checkup. Supporting opinions from PCPs highlight that these hacks are scalable and patient-centered. Clinicians see better outcomes when advice fits daily life. Challenges include competing priorities, health literacy, and social determinants like work schedules or access to safe spaces for exercise. Alternative viewpoints suggest more intensive interventions for high-risk patients, but primary care's role is to offer incremental, broadly applicable steps. Finally, these daily preventive hacks connect directly to specialty care. Better sleep and blood pressure control reduce burden on cardiology and endocrinology. Movement lowers orthopedic strain, and hydration supports nephrology. Small, consistent actions in primary care ripple across the whole health system. Pediatrics and family medicine bring a uniquely holistic perspective to One Health, because children's health is inseparable from family, community, and the environments where they grow. Define child and family-centered One Health as practical actions that protect children's well-being by recognizing connections between human health, animals, and ecosystems. This approach emphasizes prevention, education, and simple household changes that reduce risk and build lifelong healthy habits. The significance is clear. Children have developing immune systems, closer contact with animals and soil, and behaviors, like hand-to-mouth activity, that raise exposure to pathogens and environmental hazards. Family medicine adds the broader lens of household routines, caregiver behaviors, and intergenerational health patterns. Together, these specialties can prevent illness, improve nutrition, reduce injury, and teach stewardship of the environment. Start with concrete tips. Hand hygiene after outdoor play and pet contact. Explained not as nagging, but as habit building. Make hand washing fun with songs or stickers. Example 1. A pediatrician advising parents to establish a pet zone where animals are fed and sleep, keeping bedrooms pet-free to limit allergens and zoonotic exposures. Real-world application. Clinics that provide washable mats for pet areas or guidance on litter box placement reduce both asthma triggers and toxoplasmosis risk. Example 2. Family. Physicians counseling on safe backyard composting. Encourage composting of kitchen scraps while advising on compost temperature management and gloves to prevent bacterial exposure. Link this to improved food security and soil health for home gardens. Include supporting opinions from experts. Child health advocates emphasize early education about nature as protective for mental health, and veterinary public health professionals note low-cost interventions in households dramatically cut zoonotic transmission. Pediatric nutritionists promote diets incorporating responsibly sourced animal products alongside plant diversity to support microbiome development and environmental sustainability. Acknowledge challenges and alternatives. Some families lack safe outdoor space or resources to create pet zones. Cultural practices may prioritize close sleeping with animals. There's also tension between exposure that builds immunity, playing in natural environments, and risks from contaminated sites. Offer alternatives like supervised play in vetted green spaces, community garden programs, or mobile clinic outreach. Connect to other One Health areas. These family-centered measures reduce antibiotic use by preventing infections, support mental health through nature exposure, and model stewardship that shapes future public health behaviors. These simple, family-focused hacks multiply across communities, turning households into frontline One Health agents. Internal medicine and geriatrics focus on keeping people well over the long haul, and their chronic care hacks are about small, sustainable systems that prevent crises before they happen. Start by defining the approach. Chronic care means managing conditions that persist: diabetes, hypertension, heart failure, arthritis, by combining medical therapy, lifestyle habits, and coordinated care, rather than episodic fixes. The significance is huge. Effective chronic care reduces hospitalizations, preserves independence for older adults, lowers costs, and improves quality of life across the lifespan. This is quintessential One Health thinking because it links individual biology, behavior, and the social environment to health outcomes. A concrete hack is the medication simplification strategy. Internal medicine doctors and geriatricians systematically review every drug, deprescribe what's unnecessary, align dosing times, and favor once-daily formulations. Example 1. Switching a patient from multiple antihypertensives taken at different times to a single combination pill reduces missed doses and interactions. Example 2. Stopping a sedating antihistamine in an older adult can sharply cut falls and confusion. Opinions from geriatric experts emphasize that less can be more. Fewer medicines often mean better adherence and fewer side effects, though some specialists warn that deprescribing requires careful monitoring to avoid undertreatment. Another hack is proactive care coordination. Clinicians set up regular brief check-ins, phone calls, telehealth, or community nurse visits to catch early warning signs. Example 1. A heart failure program that monitors weight daily and calls when weight rises can prevent full-blown decompensation and readmission. Example 2. Diabetes teams that review glucose logs weekly and adjust treatment promptly prevent emergency hyperglycemia. Primary care physicians often champion this team-based model. Critics note it requires investment in staff and technology and may be unevenly available in resource-poor settings. Addressing social dependency. Terminants is a third hack. For older adults, hoe-using, nutrition, transport, and social isolation drive outcomes. Practical steps include screening for food insecurity and connecting patients to meal delivery, or arranging pharmacy delivery for those with mobility limits. These interventions reduce acute care usage and support long-term function. Potential challenges include time constraints in busy practices, limited reimbursement for coordination, and patient resistance to change. Nevertheless, these chronic care hacks connect directly to prevention, rehabilitation, and public health core One Health aims by keeping people functional, reducing strain on hospitals, and fostering resilient communities.